When a patient exhibiting COVID symptoms went to an LA County ER, nurse practitioner Hanky Lim rushed to help. That patient wasn't wearing a mask.
He coughed right in front of my face, right in front of my face, and I can see the saliva, the spit on my face shield.
At first, Lim didn't think it was intentional, but the patient did it again, coughed on his face without a mask in the height of the pandemic.
He got up and said to me like, "Hey, it's because of you people I got sick." And he got up and he left.
Months later, another patient dismissed Lim's recommendation to get an x-ray and instead shared with a white nurse that he didn't want any Asian healthcare workers treating him. Time is of the essence in the ER when it's about life and death. But Lim, who used to rush in, now thinks twice before approaching a patient, at times double-checking with another nurse to make sure it's safe.
I've had another person joke with me, like, why'd you guys bring Corona over here?
As the only Asian physician in her clinic, Serena Jo Talbert says the microaggressions from her patients are starting to get to her.
It wasn't really until recently that I have started to realize how harmful they've been and how they have implicitly affected my mental health.
She wrote an op-ed. This physician has had enough of anti-Asian hate, and you should too. Despite making up nearly 6% of the U.S. population, Asians play a much bigger role in the healthcare field. They are 17% of the physicians and nearly 9% of nurses in the U.S.
Part of why Asians and Asian Americans can be targeted so easily is because, in many ways, we're still othered. We're still viewed as foreigners.
All three healthcare workers we spoke to are American.
So the month of May is a time to recognize and acknowledge that we are Americans. It doesn't matter what our ancestry is. We're all Americans.
Kat Sandoval, Newsy, Chicago.